Dear students, Assalamu alaikum. Today I shall be starting with the lectures on renal physiology, and it is needless to say that how important is this system. Now, although most of you are aware of the pattern and format of my lectures, I consider it necessary here to refresh your memories. In my lecture slides, the topics are described in sections which are further divided into subsections. The subsections contain variable number of slides. Each slide has a heading at the top and description below. Most of the study material is taken from Guyton's textbook of medical physiology. The slides are designed in a specific way to serve as detailed and substantial notes. Each lecture covers a reasonable portion of the topic, which you can easily study from the textbook. Finally, as this online teaching is being carried out in highly unprecedented circumstances, I will strongly advise you to be regular and keep pace with these lectures. So good luck, and now let's have a look at the learning objectives of today's lecture. The learning objectives of today's lecture are to learn about various body fluid compartments, their constituents, and determination of fluid volumes. Let's have a look at the overview of what we will be studying in these lectures. An extremely important function of kidneys is to maintain fluid and acid-base balance. Regulation of fluid balance involves two separate components: control of extracellular fluid volume, in which the kidneys maintain salt balance, and the control of extracellular fluid osmolarity, in which the kidneys maintain water balance. The kidneys maintain acid-base balance by adjusting the urinary output of hydrogen ions and the bicarbonate ions. Now let's start with the body fluids. The maintenance of a relatively constant volume and a stable composition of the body fluids is essential for homeostasis. This is because some of the most common clinical problems arise because of abnormalities in the constancy of the body fluids. This constancy is highly remarkable, and to maintain this, fluid intake and output should be balanced. Water is the most vital and abundant component of body fluids, and we know life cannot exist without it. It constitutes 60% of body weight. Water intake and output. Ingestion in the form of liquids or water in the food amounts to about 2100 milliliters per day. and synthesis in the body as a result of oxidation of carbohydrates yields another 200 milliliters per day. So, the total intake of water is about 2300 milliliters per day. However, intake of water is highly variable among different people and in the same person even at different times. Now let's have a look at the daily loss of body water. The insensible water loss. This includes continuous loss of water by diffusion through the skin and evaporation from the respiratory tract. It is called insensible because we are not aware of it. The insensible water loss through the skin occurs independently of sweating, meaning that it is present in individuals who have congenital absence of sweat glands. It is about 300 to 400 milliliters per day, and there is increased loss in burns. Insensible water loss through the respiratory tract averages about 300 to 400 milliliters per day because the vapor pressure of the air in respiratory tract is greater than the vapor pressure of the inspired air. Water is continuously lost through the lungs with respiration. Fluid can be lost in sweat. The volume of sweat normally is about 100 milliliters per day, but it may increase to 1 to 2 liters per hour under extreme conditions. Water loss in feces. A small amount of water, around 100 milliliters per day, normally is lost in the feces. This can increase to several liters a day in people with severe diarrhea. The remaining water loss from the body occurs in the urine excreted by the kidneys, and multiple mechanisms control the rate of urine excretion, which we shall be studying in later lectures. This table shows the balance between the daily intake and output of water. In the intake, fluid ingested amount to 2100 milliliters. From metabolism, another 200 milliliters per day, making total intake equal to 2300 ml per day. The output comprises the insensible loss through skin, 350 milliliters per day, insensible from a loss from the lungs, about another 350, loss in the sweat 100 milliliters, in the feces another 100 milliliters, and in the urine about 1400 milliliters per day, amounting to a total output of 2300 milliliters per day. So you can see that the body maintains a precise balance between the water intake and the output. Now let's study the individual body fluid compartments. The total body fluid is distributed between two compartments, the extracellular fluid compartment and the intracellular fluid compartment. Total body water. In the average 70 kilogram adult man, the total body water is about 60% of the body weight, that is about 42 liters. This percentage depends upon age, gender, and degree of obesity. For example, women having more fat, their total body water is about 50% of body weight. And in newborn babies, it's about 70 to 75%. Intracellular fluid compartment. About 28 liters of fluid in the body are inside the 100 trillion cells and are collectively called the intracellular fluid. Extracellular fluid compartment. All the fluids outside the cells are collectively called the extracellular fluid. These fluids account for about 14 liters. The two largest compartments of the extracellular fluid are, number one, the interstitial fluid, which makes up about 11 liters of the extracellular fluid. And secondly, the plasma, which makes up about 3 liters. This figure shows a summary of body fluid regulation, including the major body fluid compartments, membranes that separate these compartments, and the interchange of fluid in these compartments. You can see plasma at the top and the interstitial fluid combining to form the extracellular fluid, and then at the below you can see the intracellular fluid amounting to 28 liters. Blood contains both extracellular fluid and intracellular fluid. The average blood volume of adults is about 5 liters. 60% of the blood is plasma and 40% are the red blood cells. Now another fluid compartment is the tissue fluid compartment. The tissue fluid forms from the plasma by diffusion and filtration, and this occupies the intercellular spaces. And it is also known more commonly as the interstitial fluid. So we'll be referring to interstitial fluid again and again in our discussion of various topics. Transcellular fluid compartment includes fluid in the synovial, peritoneal, pericardial, and intraocular spaces. And this also includes the cerebrospinal fluid. Transcellular fluid is considered to be a specialized type of extracellular fluid, and this constitutes about 1 to 2 liters. Constituents of extracellular fluid and intracellular fluid. This figure shows the major cations and anions of the intracellular and extracellular fluids. The concentrations shown represent the total of free and complex ions. It is clear that extracellular fluid, including plasma and interstitial fluid, contains large amounts of sodium, chloride, and bicarbonate ions, but only small quantities of potassium, calcium, magnesium, and phosphate ions. This figure shows non-electrolytes of plasma, including the phospholipids, cholesterol, neutral fat, glucose, urea, uric acid, creatinine, bilirubin, and bile salts, and their concentrations in milligrams per deciliter. Let's move on to the next topic, which is the measurement of fluid volumes in the different body fluid compartments. Now, the volume of a fluid compartment in the body can be measured by placing an indicator substance in the compartment, allowing it to disperse evenly throughout the compartment's fluid, and then analyzing the extent to which the substance becomes diluted. The indicator dilution method is based on the conservation of mass principle. The conservation of mass principle states that the total mass of a substance after dispersion in a fluid compartment will be the same as the total mass injected into the compartment. In the example shown in this figure, a dye is injected into a chamber and it is allowed to disperse till it becomes mixed in equal concentrations in all areas. Then a sample is removed and analyzed. If none of the substance leaks out of the compartment, the total mass of substance in the compartment given by volume B multiplied by concentration B must equal the mass of the substance injected, that is volume A multiplied by concentration A, as stated by the conservation of mass principle. Therefore, by simple rearrangement of the equation, one can calculate the unknown volume of chamber B as volume B is equal to volume A multiplied by concentration A divided by concentration B. To further clarify this, let's do a small calculation. Suppose 1 milliliter of a solution containing 10 milligrams per ml of dye is dispersed into chamber B. The final concentration in the chamber is 0.01 milligrams per milliliter. The unknown volume of chamber B can be calculated as volume B is equal to 1 milliliter multiplied by 10 milligrams per milliliter divided by 0.01 milligrams per milliliter equal to 1000 ml. This method can be used to measure the volume of virtually any compartment in the body, as long as number 1, the indicator disperses evenly throughout the compartment. Number 2, the indicator disperses only in the compartment that is being measured. And number 3, the indicator is not metabolized or excreted. Now, several substances can be used to measure the volume of each of the different body fluids. In this section, we shall study various methods by which volumes of specific body fluid compartments are determined. So let's first begin with the measurement of total body water. Radioactive water or heavy water can be used to measure total body water. These forms of water mix with the total body water within a few hours after being injected into the blood. Then dilution principle can be used to calculate the total body water. Another substance that has been used to measure total body water is antipyrine. Antipyrine is very lipid soluble and it distributes itself uniformly throughout the intracellular and extracellular fluid compartments. Next is the measurement of extracellular fluid volume, which can be estimated by using radioactive sodium, radioactive chloride, radioactive iothalamate, thiosulfate ions, and inulin. All these substances disperse in the plasma and interstitial fluid but do not readily permeate the cell membrane. Radioactive sodium, however, may diffuse into the cells in small amounts. Therefore, while using sodium, the true extracellular fluid volume is often called the sodium space. Well, this concludes today's lecture. I shall be continuing with the determination of volumes of other fluid compartments and other topics in the next lecture.